Hi everyone, let's see a case of Empyema Gallbladder. 85 years old female patient came with severe right upper abdominal pain. She has also complained of vomiting. On clinical examination, a palpable right hypochondriac tender lump was found. On ultrasound, a thick-walled distended gallbladder is visualized. Lumen is filled with hypoechoic fluid with echogenic granular moving particles. The Murphy sign was positive. Mild ascites is visualized. This is the picture of the gallbladder at the right hypochondriac region. The gallbladder lumen is distended and the wall is thickened. The lumen is not anechoic, and on real time the particles inside the lumen will move. This mixed echogenic substance actually represents pus. See on the real-time internal structures moving. For slush, the movement should be a little slower than what you are watching here. This highly indicates the inflammatory products, possibly pus. Thank you for watching. Don't forget to subscribe this channel for more videos.